Are you feeling pretty good?
Yeah,
Nothing hurts in your body at all?
just normal aches and stuff.
Sleeping really well?
Yeah,
You guys are getting 8 hours of sleep?
sleep till like 10:30, 12 every day. So.
If we'll let him.
Must be nice. My name is René Bravo, and I'm a primary care pediatrician in San Luis Obispo, California. I've been on the Central Coast for, about 40 years now, just enjoying life and enjoying being a physician here. I had no idea really about my career destiny till I was about 13 years of age. It was in February of 1971, the Great Silmar earthquake. I bolted out of the house, frankly. It was 6 o'clock in the morning, fell down flight of stairs when they were just examining me at the orthopedic hospital in Los Angeles. I was diagnosed with lymphoma. During that whole process of interacting with physicians, going through surgery and radiation and all of the things that you did, I started to notice something about the practitioners around me. They were profoundly caring people, smart, funny, and I realized that they were making a difference in people's lives, and that really planted the seed in becoming a physician, that whole experience. And that's how I started on my adventure in becoming a physician. When we invest in these little people's lives, we see the outcome for years and years. One of the fantastic parts of practice has been watching children as they grow up in life. Now I'm seeing the kids of my patients, so I call them grandpatients, frankly. It gives you a sense of longevity. It gives you a sense of reality in terms of what we do now does reverberate into the future. And it really is one of the most fulfilling parts of being a pediatrician. When you see a parent and they're concerned and worried about their child, that is something that is very, very sacred and important to address. When I go into a clinical interaction, I try to understand not only what they want to hear and what they need to hear, but more importantly, how they feel about how I'm explaining it to them. That interaction is critical.
He's been in the area for like almost 40 years, and everyone knows him, everyone loves him. It's just really special being, a part of his life and him being a part of ours too.
I joined CMA when I was a medical student at UCSF. It was my senior year. I had the opportunity to join the California Medical Association. I joined on a technical advisory committee. I was a medical student appointee, and I was so impressed with the doctors that I came in contact with and this whole concept of public policy and healthcare policy that I was hooked. I've been involved ever since. It was tough when I was in medical school and residency, but when I came to San Luis Obispo is when I really re-engaged fairly aggressively with organized medicine. It's personally a privilege to be part of an organization which cares very deeply for the patients of California and the practitioners of California, making sure that good public policy moves forward because it affects human life and it affects the quality of life. The CMA provides me a mechanism in which I can serve and advocate for patients and for the voiceless, for those who don't have a voice. I am very, very honored and blessed to be a doctor, to have the privilege of helping those around me. That has always driven me. But if you ask me, I tell you, family has always been such a key part of my life. How are you? Good to see you.
The way he treats families, the way he treats kids is just really amazing. Knowing that he's part of our team is just big relief for us.
I don't think I've ever heard anyone say anything bad about Dr. Bravo. It's always, he's so amazing. He makes you feel so good and like a great parent, and really makes you feel comfortable and not scared of, trying to raise a kid.
Oh, but you should be jumping on this, okay. There it is. We had no idea where we would be right now in history, where it seems that we've entered a point of chaos, in some cases significant regression in terms of science and good public health policy, and our voices have never been more important than they are now, and we need to stand together. This is our time to stand together and to fight for what is right, for what is good for healthcare, good for our patients, and good for the profession of medicine. The future of our profession is really going to be determined by the strength of our advocacy. Being the president is something that I really never dreamed about. And then I aspired to it recently because I've seen all of the good that CMA can accomplish. The California Medical Association is a powerful, positive voice in the California legislature. My hope as the president is to continue the legacy of advocacy for those who have no voice, for protecting the safety net, and making sure that all people have access to good quality, science-based health care.